Well, basically the NHI is the government's attempt to put all medical services and medical service providers into one big pot in South Africa. I don't think they will eventually be successful in doing this, but the plan is to put all private provided medical services and state provided medical services into one big pot, and for the state, of course, to be under control over this. Well, the NHI is certainly not going to improve the healthcare in South Africa. The idea behind the NHI is to take a dysfunctional state medical services provision department or division and mix that with the private sector. The private sector's medical services work quite well in South Africa, but if you mix these two systems and you put bureaucrats and politicians in charge of this new pot of medical services in South Africa, everything will be dysfunctional. No, it's not going to work. When you talk about the medical personnel that is supposed to staff the NHI, then I'm afraid the reality is that many medical people are already leaving South Africa, and a lot more people will leave South Africa if the NHI becomes a reality. So doctors and nurses and all those sort of professional people are likely to leave South Africa, and the end result will be there will not be enough professionals to work in the national health insurance and to make sure to look after the health of all South Africans. The little what we do know is that these pilot projects were complete disasters, and unfortunately politicians are simply ignoring the fact that their own pilots did not work out. Nobody really knows how much the NHI is going to cost the taxpayer. There are various estimates. Some estimates are as low as to about 200 billion annually extra, while some estimates is as much as 500 billion or even 600 billion extra annually. Now, I can tell you that the taxpayer in South Africa is already totally overburdened, and there's no way that the taxpayer can afford this kind of additional taxes in the country. The one reason simply it is going to be too expensive. We just do not have the money. A second very important reason is that the civil servants, most of them, are also members of the private sector medical schemes somewhere. So I'm pretty sure that the political partners in a way, in a form, for example, of COSATU, is going to make it very difficult for the NHI to be implemented because their members will be affected. So I believe the civil servants do not want the NHI, and they will probably try to stop that as well. But the private healthcare system in South Africa is miles ahead of what the state can provide in terms of healthcare. So make use of the state to fund the private healthcare system, not only for the selected few that can actually afford it, but to all South Africans that can actually get access then to the private healthcare system, and the quality of healthcare for all South Africans will be much better than what we're currently getting from the state.
We must judge government and its policies by the results that we've seen over the years, not by the government's good intentions. Even now they're saying that they're doing it for poor people. But I beg to differ. They're not doing it for poor people. They're just doing it to widen the net for themselves to have all this access to more funds that the NHI will eventually provide the state and those who are in power in the state. Hospitals are understaffed. There's not enough nurses, there's not enough doctors, we're just not producing enough doctors to employ. And those are things that we should be really looking into before we even think of an NHI or anything like that. We've seen news reports on those. I think, if I remember correctly, the success rate was about something like 6-8%, but I know it's less than 10%. Until such time that government sees itself as as people who can actually work with private healthcare instead of always being suspicious of them, then things will remain the same. And even NHI is not going to fix that relationship, which is quite important as far as I'm concerned. That's the million-dollar question. No one knows.